Hi everyone, hope you're all doing well, and thank you so much for joining us today for this webinar on building capacity to meet mental health needs during COVID-19. My name is Emily Scahill. I'm the Manager of Peer Advocacy, Supports, and Services at MHA's National Office, and I will be moderating today's webinar. Some notes before I introduce you to our presenter. We are recording this webinar, and I will send that out to everyone along with the slides in the next day or so. And we've also built in some time for a Q&A at the end. So in your Start Meeting window, there's a chat bubble, which you can click on to open up a messaging window. So feel free to drop any questions in there, and we'll go through some at the end. Same if you have any tech issues, toss them in there, and I will be right in that window with you. So with that, I am so excited to introduce you all to Shannah Mulvihill, today's presenter. Shannah has been the CEO of Mental Health Minnesota since 2015. She has worked in the nonprofit sector for over 20 years in the areas of communications, development, public policy, and organizational leadership. She holds a master's degree in counseling psychology and has served as counselor at the Walk-In Counseling Clinic and Crisis Connection. She is a former board chair of Open Your Heart to the Hungry and Homeless and Disaster Services Volunteer and Advisory Committee member of the Twin Cities American Red Cross. She is a certified fundraising executive and member of the Association of Fundraising Professionals. So with that, I will turn it over to Shannah to get us started.
Thank you, Emily. You can hear me okay?
Yes, sounds perfect.
Okay, perfect. Well, I'm looking forward to sharing a bit about what we've been doing at Mental Health Minnesota to meet mental health needs during this time. So I appreciate everyone joining in today. We move to the first slide. So first, really setting the stage for what we're going to talk about here today. There is an urgent and growing need for mental health care and resources during COVID-19. Many of us have seen the information from National around anxiety screening on the Mental Health America National website, and that they've increased significantly in recent weeks. Many people are facing unemployment. Record numbers, really, and parents are trying to balance working from home with homeschooling their children, which I can tell you from personal experience is challenging, to say the least. And I think one of the hardest parts of this is that there's no real end date to what's happening in the world right now. And that can cause a lot of additional stress and certainly result in compassion fatigue for those of us who are working to serve clients and trying to evaluate what else we can be doing to meet needs. Many people might be coping right now, but certainly may hit a wall in the near future, and we need to be ready for that. Slide, please. So the good news, because I think it's important to talk about the good news around what's happening, is first, people are really hungry for information and resources. As an organization, we've had record numbers in visits to our websites, as well as in really active social media engagement. People want information and are seeking good and dependable resources for that. And I think that that's a role many of us can play in terms of making sure that people have good information and are considering their mental health. Many people want to volunteer to help. In any type of disaster situation, this is a common response, that people want to do something, take action, volunteer in some way. Mental health is being talked about, even if many funders haven't yet identified it as a high priority. For example, last week our governor talked about mental health during his daily press briefing, specifically calling out Mental Health Minnesota and a number of other organizations as resources. I've been getting emails from our congressional members as part of their newsletters, and many of them are also referring to mental health resources. And so I think that's it's important that we're hearing more about mental health. Again, even though funders haven't really identified that as a high priority, and are generally more focused on a lot of basic needs right now, but I do think that will shift over time. More and more people are noticing that their mental health impacts their physical health, their family life, their efficiency at work, etc. Again, folks who maybe haven't really thought about that in the past. And finally, that social isolation is being recognized as an actual problem. There are studies on the impact of loneliness and social isolation, not just on mental health, but physical health as well. One even compared the physical impact of ongoing social isolation to smoking 15 cigarettes a day. A larger understanding, I think, of the impact of isolation will help us address it better in the future. Slide, please. So there are certainly many challenges to meeting mental health needs that many of us are experiencing. First, traditional methods of outreach are largely unavailable. As an example, some of the primary ways we promote our services as an organization is doing community presentations, having our ambassadors do speeches, doing booths at conferences that a lot of providers are at. All of those options are off the table right now, and so we're really needing to step back and think about some new ways to do outreach. Services and programs have to be delivered remotely or not at all. So for us at Mental Health Minnesota, most of our services were already delivered via phone, text, or online chat. That was an easier transition for us, I would say, than perhaps it is for a lot of providers who are now needing to shift to telemedicine or actually not be able to deliver different services that really require an in-home visit. At the same time, those services that we did do that were in person are being reconsidered, given some of the challenges around access to technology and high-speed internet. Many of us are in states with large rural areas, and that has really pointed to a big disparity in terms of access to these things where people are able to stay connected. So as a result, programs have to be reevaluated to determine whether or not they should even be offered right now. There's one program that we have called Steps to Employment, for example, where we were working and offering workshops to those living with serious mental illness who were interested in seeking employment as part of their recovery. Those workshops were in person. We're not sure if it would really work very well to deliver them electronically, and it just, it's kind of a question of whether or not we should even be doing that right now, given that there are so many people who are unemployed right now. Thinking about employment is may not be realistic right now. A lot of us have fundraising events that have been put on hold or canceled. As I noted, a lot of grant funders are more focused on basic needs, so kind of overlooking mental health at this time. And loan programs are either low on funds or confusing with long wait times. For example, we applied for the Paycheck Protection Program, and we were one of the lucky ones. Our application was accepted and funded. Other organizations were not as lucky, although there is hope with some legislation moving this week at the federal level that would provide more funding for that program in particular. Slide, please. So in short, really, the challenges are daunting. The need is great, we've all seen that, and funding is limited. So given all this, how do you build capacity to meet the needs that we're all seeing out there? Slide. So what I'm going to kind of focus on today is the fact that building capacity doesn't necessarily have to be expensive. I think when most of us think about building capacity, we're thinking about program expansion, adding staff, adding facilities, etc. That gets costly very quickly. But it doesn't have to be if you take some creative routes to do it. And so I'm going to talk a bit about how we did that, because what it did take for us was a willingness to explore some new approaches to our work, build collaborations, which have been very important, and redefine who we serve to meet the current needs. Slide. So challenges can be overcome. We do have a lot of them that we're facing as organizations, but there are some ways that we can work to address those. First, by relying on national resources and information. For example, we were able to quickly add a web page on our website dedicated to mental health during COVID-19, thanks to all of the resources pulled together by Mental Health America. If you haven't looked at them, do it. They're very helpful and great resources. And Mental Health America has also kept its affiliates up to date on federal legislation that impacts their work, which again saves significant time and energy of our own staff to try to track all of that information. It's about finding new approaches to outreach and marketing. You know, I mentioned that the old ways that we were using to do outreach and promote our programs are kind of off the table, at least for the time being, and could be for some time. At the same time, we know that there is significant need, and so we want to make sure that we're putting that information in the right hands. So we've been doing more targeted and direct outreach to providers, for example, to promote our programs that are more specifically dedicated to those who are living with a mental illness, and also connecting with employers to promote things like screening and our helpline for those who maybe haven't experienced mental health concerns in the past. Making adjustments to existing programs and services. So I'll talk about some ways we did that in just a moment. Identifying and meeting the emerging needs. So really being able to determine what else is needed out there and what you might be able to do to address that. Building partnerships and collaborations, that has been very key for us in our work to do more during this time when we don't have additional funds to do more. Redefining who we serve and tailoring programs and outreach. You know, there are people who have never considered taking a mental health screening or talking to a therapist who are now struggling to cope. And so it's important that we think about how to reach those populations, as well as how we message about mental health to make sure that it feels safe and open for people to reach out. And making the case to potential funders. If you haven't yet developed your case statement for funders, do it now, because we need to be pushing out information around why mental health is important. And I think Mental Health Month coming up in May gives us a really prime opportunity to do that. So what are the needs and how do we meet them? So some ways that we were able to identify what the needs were was reaching out to different organizations and groups, as well as participating as much as possible in conversations that were already taking place and maybe shifting the group's focus around back to mental health. For example, we have been participating in weekly calls with metro area crisis providers here in Minnesota, as well as with a group of hospitals and others who are working to meet the mental health needs of the healthcare community. And that's helped us identify needs and certainly helped us identify potential partners to meet those. We've looked for ways we can maintain and grow our programs and reach new populations and develop new services without stretching our existing staff too far or drifting from our mission and core work. For most of us, it's not like we were low on things to do already. And so it's been important that as we consider new services, new programs, that we're really keeping in mind that we need to be not putting too much additional stress and pressure on existing staff. So first we needed, before we even thought about new things, we really needed to make sure that our successful programs were able to adapt so that we'd be able to maintain and even grow. So one of those programs is our Mental Health Ambassador Program. That program has more than 300 members across Minnesota. All have a lived mental health experience and help promote hope, recovery, and wellness by sharing their stories and experiences with community members and policymakers, as well as through surveys and other interaction with our organization that helps us determine next steps, both public policy-wise and within our own organization. Our most active ambassadors are very used to being out in the community, giving speeches, doing tabling events, fundraising, doing other things. So now what, given that they are all stuck at home like everyone else? So we stepped back and came up with some things for our ambassadors to work on while they're not able to do the things that they love to do. First, we've asked ambassadors to record videos of their story and how they're coping during this time, and those will be edited and then released on social media in May. We're also working on a new survey to keep our ambassadors engaged, and our survey will focus more on identifying community needs for our public policy work based on people's own experience within the mental health system in Minnesota. We have also started to hold group meetings for ambassadors twice a week to keep them connected to us. Slide, please. So another program that we wanted to make sure we preserved access to was the Minnesota Warm Line. Our Warm Line provides statewide peer support for mental health recovery and wellness. It's open in the evenings, Monday through Saturday, just 5 to 10, and it's available by phone and text. Our Warm Line is staffed and supervised by certified peer specialists, and in 2019, it took more than 12,000 calls. We have been seeing a pretty significant increase in use in the first quarter of 2020 over the first quarter of 2019, about 15%. And specifically, if we look at Hennepin County, which includes the city of Minneapolis here in Minnesota, the number of calls coming from Hennepin County has increased by 50%. Incidentally, Hennepin County also has the highest number of diagnosed COVID cases by far in the state. And one of the pieces that I wanted to make sure I noted was 1 in 5 of our callers say that they would call crisis or EMS or go to the emergency room if they couldn't reach us. And I think that number is particularly important given that right now we don't really want people to go to the hospital unless they absolutely need to. And I think that's one of the things that makes this service, this type of service, all the more important right now. So some ways that we've adapted the service during COVID-19, as I noted, the service was already by phone or text, and our phone system is cloud-based, so that made it a much easier transition to remote work for our staff. But we still had a number of hurdles we needed to address. First was the need to purchase and set up additional equipment for staff. They were taking calls via regular phones, but they used iPads for record keeping, time clock, etc. But we had, because we have 4 operators working at a time plus 1 supervisor, we had 4 iPads and 1 laptop for them to use. And so obviously that was not going to work given that we needed to move to remote work. We needed to determine how to keep our staff connected during shifts. We have set up our Warm Line intentionally for our staff to work out of the same place to ensure that our peer staff get the support that they need. And so we needed to make sure that we were still going to be able to provide that support and supervision over our staff even when they were working remotely. And finally, making sure that we had the staff training and technology troubleshooting available to make all of this work as we move to adding apps on the iPads for responding to calls rather than using a phone. So how we address them, we did need to purchase some additional iPads. And so we did that. We were able to kind of borrow laptops from other staff who had their own laptop at home to be able to minimize additional technology purchases. We started using Google Hangouts successfully for the Warm Line staff to be able to stay in touch during their evening shifts so that they were able to get the support that they need when they took particularly difficult calls. And you know, to get everything up and running, we are lucky enough to have an Apple consultant on our board. So he volunteered his time to come in and set up all the iPads for us, which was enormously helpful and a huge time saver. And we've made some staffing adjustments as well. For example, our program manager manages both our helpline and our warm line. So normally would be taking helpline calls during the day, but there were a lot of troubleshooting issues that were coming up for the warm line in the evening, which meant that her day extended much longer than we wanted it to. So we've been able to shift some of those helpline calls over to other staff members to be able to minimize burnout for her in particular. So as stay-at-home orders began, we started trying to take steps to reduce social isolation. Certainly social distancing has increased feelings of loneliness and isolation for many people. And even before COVID-19, 40% of older adults report regular feelings of loneliness and isolation. And 75% of our warm line callers already were feeling isolated, which was the primary reason that they would call and reach out to us. Some of them started calling us repeatedly every night. And our rule, if you will, is one call per night so that more people can use the service. For many people who are living with serious mental illness, the supports that they had in place may be at this point unavailable or reduced, such as in-home services, clubhouses, drop-in centers, things that they really relied on to stay connected to others and stay well. So what could we do to help? So we launched a new initiative we called Connect with the intention to reduce social isolation. So the Connect service provides social connections by phone between our volunteers and people who may be struggling with social isolation, loneliness, stress, anxiety, or worry during the social distancing related to COVID-19. People sign up to get calls by either calling our helpline or by filling out a short form on our website, and then they start getting calls from our volunteers within 2 to 3 days. Our volunteers do complete background checks and are given guidance and direction for making calls, as well as resources to provide to folks that they may think would be helpful for them. These are they're quick calls. Most of them last, maybe 10 minutes or so, but it's really kind of a we're in this together approach. And we've had really good feedback from those who have both served as volunteers as well as those who are getting the calls. Promotion for the program has largely been done through social media. We've had a number of community newspapers pick up our press release on it and promote it for us as well. And then we've been doing some targeted outreach to mental health providers as well to encourage them to use this service as this service and the Warm Line as a tool for their clients to try to stay well. The next piece that we wanted to explore was how to take care of those who are taking care of us. People working in healthcare, emergency services, and other essential services are experiencing unprecedented levels of stress. We've been participating in a large group of providers, hospital systems, et cetera, to identify some specific mental health needs based on what people's jobs actually are. Noting that the of a direct care nurse is different from that of an administrator, but both are certainly experiencing stresses, and we should think about whether or not there are specific targeted things we can do to help them differently. We're hosting a panel of nurses on Zoom next week talking about the importance of taking care of mental health needs as well. And finally, we also collaborated to develop a new service to provide mental health support to these workers during this time as well. So that service has been called COVID Cares, and it's about supporting the mental health of those on the front lines. So this service provides mental health support to healthcare workers, first responders, and other essential personnel. We've been promoting it to nursing home staff, to mental health and substance use disorder providers, to shelter workers, any of those who are directly serving people and are experiencing high levels of stress. Collaboration was key as we worked to set this up. It was developed as a partnership between the Minnesota Psychiatric Society, the Minnesota Psychological Association, and Mental Health Minnesota. Support is provided by phone by mental health professionals who are volunteering their time and is available 9 a.m. to 9 p.m. every day of the week. We've been promoting it we created a poster that's been sent out to hospital systems and other key locations. We've been told it's plastered all over some of those locations, so that's great. We hope many people hear about this and use the service. We added a QR code that goes directly to the page where you can see who's on duty at any given time and do a one-click from a cell phone to call that person at that time. We've also promoted the service via social media and through emails to key organizations. For example, the Minnesota Nurses, the Care Providers of Minnesota, etc. I wanted to note some thoughts on managing a new army of volunteers, because it can certainly be daunting. We had, as I noted before, many people want to volunteer, they want to take action, they want to do something to help. So there are a lot of people who jumped on the opportunities. In just a few weeks' time, there were more than 25 Connect volunteers, and more than 70 mental health professionals have signed up to volunteer for COVID Cares. This is it's been an outstanding response to really see people stepping up and wanting to help others. What it has pointed to is certainly the importance of managing the expectations of volunteers around starting up new services. Because these are new things, promotion takes time, and I tend to believe that it's important that you ensure that you have the volunteers you need to carry out the work before you start to promote it out to users, because certainly we wouldn't want to set the expectation from potential users that they can reach someone or be called by someone and then not have the folks available to actually take or make those calls. So, we've had some response from our volunteers of, that they didn't get any calls during a given shift, or they didn't have very many people to call. And our response has largely been just hold tight. We do expect that as things continue to go the way they have, which is, we have not hit a peak yet at this point, and we certainly don't have an end in sight. We expect that more and more people are going to be seeking these services. Communication and thank you messages then as a result to volunteers have been essential to really keep them motivated and connected to the work that we're doing. And I wanted to also just note that tracking data is important. Even if it's a short-term program, And by data, we're not collecting names or any identifiable information at all about those who are using these services. What we really want to track is, are they, how they're being used, where they're being used. So we're trying to track county information. And by making sure that you track that data, it will help you identify trends, promote success, and certainly make the case for funding in the future. So what's next? So those are some things that we've done so far. In terms of stepping back to say, what else can we do? What's next? One is making the case for funding. And as an example, really being able to share how the warm line service helps keep people out of the hospital. I think that's particularly poignant and important right now. And so it's certainly makes a good case for funding when opportunities are available. We are working on promoting our services in a more targeted way, really kind of stepping back to say who uses X, Y, or Z. And so we're, when we're used to being out in the community talking about our programs and services, we're giving a speech to a large room where we don't really know exactly who's there and who might use what service, so we tend to cover them all. Our interest now is in thinking about, okay, what services are more dedicated to those who are already living with a mental health condition, and what are more directed at those who are not, but are starting to get worried about their stress levels. And so thinking about, for example, working more directly with mental health professionals to promote our Warm Line and the Connect program, and using our contacts with employers to promote things like the helpline and the online screening tools. Determining how and if to offer programs in the future and how long. So these new pieces that we've added, right now we're thinking that these services will go through the end of August, but that's really a moving target based on use and ongoing needs. Maybe it will end sooner, maybe it will go considerably longer. We just don't have a sense of that right now. Finding new ways to support our staff when we're all working from home, particularly in mental health. Many of us do need to be able to connect with others, to process, to think through new ways to reach someone. And so it's important that we are able to provide that even when we can't do it in person. For example, we are working with mental health professionals to help our Warm Line staff process particularly difficult calls that they may be struggling with as peer specialists. Considering how to use offers for help, and in particular, I guess I would say unsolicited offers for help, because there are many. I've had different opportunities pop up. Just yesterday, I heard from the director of a psychology doctoral program, wondering what her students could do to help. And so it's been an opportunity for us to step back and think about what else we could be doing, and what service others can help provide. And we're also really starting to identify other populations and groups to serve. We've kind of checked off finding some new ways to reach out to those who are struggling at home. We've got capacity yet for the Warm Line to meet the needs of those who are very isolated. And we've certainly been working to address the needs of healthcare professionals and other essential workers. Now we're thinking about college students and how we might be able to meet their needs, and what types of services and what types of technology would be most helpful in our efforts around that. People who've been furloughed or laid off. that number, I fear, will continue to grow as the amount of time before people feel comfortable frequenting businesses and restaurants extends. And those who are working from home and homeschooling children, what can we do to support them? What can we do to encourage them to be easy on themselves, given that it is a difficult task? So those are some of the next populations, I guess, that we've been thinking about how we can serve better. So with that, that wraps up my my presentation, but I am certainly happy to answer questions either now or moving into the future. I did include my contact information at the end as well. I have heard from several other Mental Health America affiliates who were interested in some of the work we're doing with the Warm Line, with Connect, and with healthcare providers and the mental health professionals serving them. So, Emily, I'm happy to take questions if there are any.
Great. Thanks so much for sharing. Yes, we have plenty of time for questions. So as I said, people are welcome to go ahead and ask questions in the chat box right now. And we do have a few already. So we had some on your Connect initiative. So specifically, how long are the phone calls, and then are they billable or free community outreach? And then if you could also just elaborate on that a bit more.
Sure. So the Connect initiative is not a billable service. We actually don't do any billable services through Mental Health Minnesota directly. It is volunteers who are just community volunteers. So I think there are a couple who are mental health professionals who have volunteered, but it's not intended to be anything more than a connection from one person to another. And the calls generally last, we recommend to volunteers that they keep them at, 15 to 20 minutes max. Most of them have been closer to, say, 10 to 15 minutes. So they're not long calls. They're more about checking in and showing the person who is having a hard time that somebody cares about them.
Great, thanks. Another great question. What has been the biggest lesson you've learned in developing new programs on the fly?
I would say the biggest lesson has been really about managing those volunteer expectations that I noted, and doing it with grace and making sure that our volunteers know how much we appreciate their willingness to help, even if they haven't had a lot of opportunity to actually do the helping, and really thinking through how to set things up and how to get people to be able to sign up easily and in a familiar way. We use Sign Up Genius for people to sign up for shifts to make calls out through our Connect program. We also use that for mental health professionals to sign up for weekly shifts for the program for healthcare workers as well. So I think the biggest lesson learned for us is that in the intent to do good, there can be some hurdles, and in particular making sure that we're really managing expectations for volunteers and setting the program up for success by making sure that we've got folks ready and waiting to take calls if needed.
Great. And then another one on phone calls. Are there special techniques for how to talk to individuals who are feeling isolated via phone call if someone is looking to start out something similar?
What the direction that we really gave our volunteers is essentially, that it should be like calling a friend and having a casual conversation. Talk about the weather, talk about, whatever it is someone wants to talk about. Sometimes even if that means it's a 2-minute phone call, that it's just, how are you doing? You don't have to push it too long. It can really be something very short, but it is very impactful for people who may not hear from anyone else all day. And so that's kind of the direction we've given our volunteers. But I'm certainly happy to talk more about that directly with anyone who is interested in doing something similar.
Wonderful. And then it looks like we just have one more. Will you be releasing a report or doing a webinar, writing an article or anything on the results of what you found in terms of different needs for different types of workers?
I expect that we will. So that's been part of a larger group in Minnesota that had been working overall on a variety of topics related to healthcare and has focused in at this point on mental health. And so that's kind of a work in progress, but I would expect that there will be some information. I think it's in draft form right now with identifying what some primary concerns and outreach opportunities are for different healthcare professionals. And there is some information on that website now that I can certainly link to from our own website to give some thoughts and share some resources that we've developed for healthcare providers.
Great. So that seems like all the questions we have for now. It looks like most people are transitioning over to thanking you and heading out. But I did want to highlight one great comment that I saw. So someone mentioned, we've been working on trying to change the we are socially distancing or we are in social isolation phrases to more proactive and positive ones, like we are physically distancing while building connections. And I thought that was a great point to bring up, the importance of language and framing things in a more positive way while we all go through this time together. So thank you, Shannah, for a wonderful presentation, and thank you to everyone who joined us today. I will be in touch with everyone in the next day or so to get you all the recording and a copy of the slides. And stay safe and healthy and enjoy the rest of your afternoon. Thanks, everyone.
Thank you.